Stress. Have you ever experienced it with this course, this semester, or even this year? Perhaps with your job, your family, or your friends, or maybe all of the above at the same time. Have you noticed how you react to stress, what it does to your mood, your life satisfaction, or your overall health? Do you know how you cope with stress? Is it positive or a negative stress reliever? Well, today I'm going to be going over how stress directly relates to one's quality of health and well-being. Hi, my name is Anne Marie Mellon Morris with HEA 490 Seminars in Health at the University of North Carolina at Greensboro. And I'm here to present the Healthy People 2020 topic, Health-Related Quality of Life and Well-Being. This topic is very new to Healthy People 2020, and there are not objectives listed currently. It is under development. However, the Department of Health and Human Services are open to suggestions about this topic. Healthy People 2020 define health-related quality of life as a multi-dimensional concept that includes domains related to physical, mental, emotional, and social functioning. It goes beyond measuring population health, life expectancy, and cause of death, and it focuses on the impact of health status has on quality of life. Well-being assesses the positive aspect of a person's life, such as positive emotion and life satisfaction. I chose this topic because I work with various groups of people in physical education and physical therapy settings. I work with students, clients, and patients throughout the day. I've noticed that there is a common denominator between all of them, that they all deal with some level of stress that affects their daily lives. I notice that when I focus on their stress and work on decreasing their stress level and giving them some coping skills, that their health outcomes increase greatly in comparison to when I don't address their stress levels at all. Personally, I have noticed that my stress level increases and my health decreases. So as I'm trying to finish my education, go to work, and manage a family, that I get more headaches, more fatigue, and more joint pain. So I believe having the knowledge about stress and how to use proper coping skills can greatly improve health and quality of life and well-being. So let's start with defining stress. I have found great information on our course book from HEA 310 and HEA 201, which is Mental Health and Health Basics. The definition of stress is the experience of a perceived threat, real or imagined, to one's well-being resulting from a series of physiological responses and adaptation. So stress can be categorized in two sections. Eustress is the stress that we like, that makes us feel really good, and that has positive influence on us. Getting married, graduating from college, having a baby. De-stress is the negative stress that affects our health, and that is academic difficulties, getting a divorce, and experiencing a death of a family member or friend. The body reacts to stress by the fight or flight response, and that comes from the sympathetic nervous system. When that system is overloaded and on alert 24/7 or more hours of the day than not, that's when there's a negative impact on one's health. So we need to learn how to relax and take a breath and tap into the parasympathetic nervous system. There are various factors that influence the response of stress, and in my research, I attended Dr. Dumas's stress-related disorders lecture. He came to North Carolina, and he discussed that toxic stress in children affect the way they react to stress in adulthood. So if a child has a mother who has postpartum depression, the child lives in an environment of poverty, family neglect, violence, abuse, and life trauma, can affect their way of dealing with stress into adulthood. Personalities A, B, and C differ in how they deal with stress. Personality A tends to be the hostile type of personality, but when it comes to dealing with health and stress, they want to know all about their diagnosis, and they want to beat the odds. So they're very proactive, and they're ready to fight it. Personality C, their personality tends to be anger suppression, hopelessness, learned helplessness. They are associated with increased pain intensity, and they have difficulties expressing emotion. Nova Science reports that we can inherit DNA and stress-related issues from at least 2 generations. So we can actually look into our grandparents and parents and see what stressors they have and see how that influences us today. Epigenetics are the markers on the DNA, and epigenetics are the ones that are affected by modifiable environmental factors such as stress. So the epigenetic can alter the DNA. Health issues caused by stress. So when we're under stress, we have an increased level of pain that can influence the amount of headaches we get, fibromyalgia pain, discomfort with PMS, and pregnancies. With depression, stress is a major factor. Obesity, quality of life, memory, and cognition, and the process of aging increases. So with stress as well, it does decrease our strength of our immune system. Stress does not directly cause disease, but it leaves us open to illness. There are several ways to cope with stress in positive ways, and you can practice predictability and control. Predictability is when you actually can predict something's going to happen and then prepare for it or control it. So such as if you know there's going to be traffic at 5, you can prepare for it by either deciding to be patient and wait in line or go a little earlier or a little later. As far as daily stress, I know we always hear about you have to exercise to decrease stress, but exercise has to be something you like, because if you are forced to exercise, then your body just goes into de-stress, and we don't want that. Getting fresh air, some sunshine, practicing mind and body exercises such as yoga and meditation, having social support and frustration outlets. It's good to practice reward substitution. So if there's something unhealthy that you do to relieve stress, such as smoking, then you want to replace it with something else that relieves your stress, such as having lunch with a friend, taking a walk, connecting with others, or even helping others. PubMed posted a study from the Australian Journal of Primary Health in 2010, and they state that mind and body therapies are effective ways to increase quality of life for those with chronic diseases. So lastly, I'd like to leave you with advice from Dr. Dumas's lecture. He states, for coping with stress, to hope for the best, don't fix what is broken, be patient in social settings. In relating with others, don't be quick to judge, because remember, childhood trauma affects those into their adulthood, so you don't know their whole history. So have some social patience. And then I also recommend this book, Why Zebras Don't Get Ulcers. And this is a guide to stress-related disorders, and coping. And this would be valuable perhaps in your upcoming career. Thank you, and I'd like to congratulate you on the upcoming graduation. I hope you enjoyed my presentation. Thank you.